January 28th, 2020, the first COVID test hits the United States market. By February 6th of 2020, they were being released to the public. By March 11th of 2020, Donald Trump announced a national emergency. We had Tom Hanks, an NBA player, come out and say they had the coronavirus, and it became a national pandemic. Over the next 2 years, testing continued to ramp up. When the Omicron variant hit, even more testing happened. And by March 22nd of 2023, the United States government had said that the uninsured program for testing COVID patients was done. They announced about 3 days before to medical providers and to laboratories that they had those 3 days to get all the patients that they had tested into the billing cycle if they wanted them to get reimbursed. So they all did a mass push to hurry up and try to get their test that they had already done into the billing cycle so they could be reimbursed. This was highly unusual. Usually they get like at least a year to get them into billing, as it takes time to get all the data, send it out. And they were more concerned about treating patients at this time than they were about getting their billing in. Why would they have to worry? But when the announcement came out, they all hurried up and got their patients into the billing system. This program was run by a government agency called HRSA, HRSA. They were the ones in charge of the uninsured payment program, handling insurance payments that were for non-insured payments. This program was then managed by a private company called Optum, which many of you had heard. And an interesting thing happened. On March 22nd of 2022, when that program stopped, when a laboratory would call Optum and say, hey, we're curious about the payment for this patient, they would literally say that the COVID program has no funding at this moment, and when they do have funding, the payments will continue. These calls continued every time they call for 14 months. As of January 31st of 2023, there was still $90.5 billion that was earmarked unobligated and unexpired for this COVID testing. However, by June 3rd of 2023, President now Joe Biden passed what's called the Fiscal Responsibility Act of 2023. It's like 41 pages. I went through it. It tries to have a lot of cuts on things because they were trying to raise the ceiling so that they could keep the government open. That happens a lot. We know they have the debt ceiling crisis. Are they going to keep the government open? So this Fiscal Responsibility Act was a measure to try to cut spending to make everybody happy. They were supposedly cut military spending, other spending that was unobligated. Included in that was about $5.8 billion that was still owed to the first responders, the laboratories and the medical companies who had taken care of this pandemic on their own dime. Right? These tests weren't free. Some people paid like up to $40 a test for the material alone for these COVID tests. So they were paying the money for these tests, testing them, trying to pay all their staff, their workers, everything else, waiting to be reimbursed. And so that money was also included in the Fiscal Responsibility Act of 2023 and saying they do not have to pay the first responder debt. So now you have as a situation with these first responders, there's an article in CBS News Chicago about a lab owner who sunk in millions of dollars of their own money to start a laboratory to help the pandemic and never received a dollar. These people didn't do anything wrong. Many people were investigated. The government sent FBI, DOJ, after several laboratories that I know, and then lots of them that I called around the country. This was a regular process trying to weed out who they thought shouldn't get paid. Well, the ones that still passed the test never got paid. In fact, it's even worse. In some cases, the money that was sent to these laboratories, multiple across the nation, unrelated to each other, they took the money back out automatically without any notice. And when you call out them, they don't even know that, they don't even have contact that it happened. They can't even see that the money came out. They can only see the money they sent. So HRSA actually took money out of payments to first responders after they were already made, and says that they do not have to pay this debt, citing the Fiscal Responsibility Act of 2023. Now, in that time period, hundreds of tens of billions of dollars, over $100 billion, has gone out to the war efforts in foreign countries. This is not a dialogue on those wars, pro or against, not the conversation. What is the conversation is that there was $90.5 billion ready to go as of January of 2023 for first responders, and by June of 2023, those people hadn't been paid, but yet the money was gone. And billions of dollars were sent to other countries. So the money, not saying that money was what was sent, but the amount of money owed, way more than that, was able to go to other crises when they popped up. And the money to first responders is still not there. Personally, I was hugely affected by this. I've lost everything in my life. I'm having to start my life over because of this. And I'm not the only one. I've talked to dozens and dozens of labs and medical companies around the country who all have the same thing. The FBI would go through their sock drawer looking for anything, and when they would come up clean, they still weren't paid. So what can be done of this? Reaching out to anybody who can make some noise. This needs to be resolved, and right now, the first responders don't have a voice, and we're looking for help.